Hey everyone, Dr. Abdulrahman here. Get ready to dive into the skeletal system, the incredible framework that protects our vitals and powers every move we make. Let's go.
Today, we're diving deep, classifying axial and appendicular bones, also talking about the different shape of the bone. Also, we will talk about the classification of cartilages, uncovering the microanatomy of our bone tissues.
In embryos, most of the skeleton is hyaline cartilage, which ossifies into solid bone as we grow. By adulthood, most of that flexible framework has been replaced by the rigid system we have today.
Cartilage in adults is only found in isolated areas, such as external ear, elastic cartilage, distal end and lateral region of nose, hyaline cartilage, larynx, hyaline cartilage except epiglottis, which is elastic cartilage, trachea, hyaline cartilage, parts of rib cage, hyaline cartilage, joints. Classification of bones based on type of osseous tissue. Compact bone, smooth and homogeneous. Spongy or cancellous bone, made of trabeculae and has a lot of open space. Classification of bones based on their relative gross anatomy. Long bone, short bone, flat bone, irregular bone, sesamoid bone, wormian or sutural bone.
Bone markings. Projections that are sites of muscle and ligament attachment. Tuberosity. Crest. Trochanter. Line. Tubercle. Epicondyle. Spine. Process. Projections that help form joints. Head. Facet. Condyle. Ramus. Trochlea.
Depressions and openings that allow blood vessels and nerves to pass. Meatus. Fossa. Groove. Fissure. Foramen.
Let's uncover the gross anatomy of the typical long bone. Diaphysis, periosteum, epiphysis, articular cartilage, epiphyseal line, medullary cavity, yellow marrow, trabeculae, nutrient artery. Let's look how is the bone tissue, the microscopic structure of compact bone. Central canal, lacunae, osteocytes, circumferential lamellae, concentric lamellae, interstitial lamellae, osteon, canaliculi, perforating canals.
It's time to put names to the frames. We're diving deep into bone identification, starting right at the center with the axial system, then sweeping through the limbs of the appendicular skeleton.
The axial skeleton is divided into three parts: skull, vertebral column, thoracic cage. The appendicular skeleton is divided into two parts: the pectoral and pelvic girdles, the upper and lower limbs. The skull. Cranial bones enclose and protect fragile tissue. 8 large flat bones. 2 paired bones, parietal and temporal. 4 single bones, frontal, occipital, sphenoid, ethmoid. Facial bones form the base for facial muscles and form an anterior opening for the eyes. 14 bones. 12 paired bones, maxillae, palatine, nasal, zygomatic, lacrimal, inferior nasal conchae. 2 single bones, mandible, vomer. All skull bones except the mandible are joined by interlocking joints called sutures.
The cranium.
Cranial vault or calvaria, superior, lateral, and posterior walls of the skull. Cranial floor or base, anterior fossa, middle fossa, posterior fossa.
Sutures of the skull. Coronal suture, between parietal and frontal bones. Sagittal suture, between parietal bones. Lambdoid suture, between occipital and parietal bones. Squamous suture, between parietal and temporal bones.
Frontal bone, anterior portion of the cranium, forms forehead, superior part of the orbit, floor of anterior cranial fossa. Parietal bone, forms sides of the cranium. Temporal bone. Occipital bone, forms floor and back wall of cranium, joins sphenoid anteriorly. Sphenoid bone, bat-shaped bone, forms anterior plateau of middle cranial fossa. Ethmoid bone, irregularly shaped bone found anterior to sphenoid, forms roof of nasal cavity, upper nasal septum, and medial orbit walls.
Now let's identify the bones of the skull. Frontal bone. Supraorbital foramen. Parietal bone. Sagittal suture. Coronal suture. Temporal bone. Squamous suture. Zygomatic process. Mandibular fossa. External auditory meatus. Styloid process. Mastoid process. Internal acoustic meatus. Occipital bone. Foramen magnum. Occipital condyle. Sphenoid bone. Greater wings. Sella turcica. Ethmoid bone. Crista galli. Cribriform plate. Perpendicular plate. Superior and middle nasal conchae.
Facial bones. First, the maxillae. It features the alveolar margin, the palatine process, and the incisive fossa. Next, the mandible. This includes the body, the ramus, which is the vertical portion, and the mandibular condyle, which articulates with the temporal bone. Continuing with the mandible, we find the coronoid process, the angle, the alveolar margin, containing the sockets for teeth, the mental foramen, and the mandibular foramen. Finally, the lacrimal bones. These are pierced by the lacrimal fossa, which serves as the passageway for tears.
Cranial foramens. Cranial foramens to identify. Let's begin with the external view. Identify the supraorbital foramen, the infraorbital foramen, and the mental foramen. Next, look for the stylomastoid foramen, the carotid canal, the external auditory meatus, which leads to the eardrum, and the incisive fossa. Now, shifting to the internal view. Locate the optic canal, the superior and inferior orbital fissures, and the foramen rotundum. Continuing through the base of the skull, find the foramen ovale, the foramen spinosum, and the foramen lacerum. Finally, identify the jugular foramen, the internal acoustic meatus, the hypoglossal canal, and the foramen magnum, the large opening for the spinal cord.
Hyoid bone, not considered a skull bone, located above the larynx, point of attachment for many tongue and neck muscles, does not articulate with any other bone in the body. Unique feature.
Now that we've finished the skull,
Let's study the vertebral column. The column is composed of several vertebrae. There are 7 cervical, 12 thoracic, and 5 lumbar. At the base, we find the 5 fused vertebrae of the sacrum and the 3 to 5 fused vertebrae of the coccyx. Next, let's look at the intervertebral discs. These are pads of fibrocartilage located between the vertebrae. Each disc has 2 main parts. First, the nucleus pulposus, which is the central soft region. And second, the annulus fibrosus, the outer ring of collagen fibers. When the nucleus pulposus protrudes through the outer ring, it results in a herniated disc.
Let's examining spinal curvatures. Primary curvatures, present at birth. Thoracic, convex. Sacral, convex. Secondary curvatures, develops after birth. Cervical, concave. Lumbar, concave. Abnormal curvatures of spine. Kyphosis, lordosis, scoliosis.
Structure of a typical vertebra. Body, anterior rounded portion. Vertebral foramen, opening for the spinal cord. Transverse process, lateral projections. Spinous process, single, medial, posterior projection. Intervertebral foramina, between 2 adjacent vertebrae, passageway for spinal nerves.
Cervical vertebrae. Transverse foramina, only in cervical vertebrae. Atlas, or C1. No body. Joins the head and provides for range of motion when you nod to say yes. Axis, or C2. Odontoid process, or dens, allows rotation of the head when you nod to say no.
Thoracic vertebrae. Long spinal process, oriented downward. No transverse foramen. Lumbar vertebrae. Massive body. Short, thick, more horizontal spinous processes. No rib facets. No transverse foramina. Superior and inferior articular processes present.
Sacrum. Medial sacral crest, remnant of spinous processes. Uli, formed by fusion of transverse processes, articulate with hip bones. Sacral foramina, passageway for blood vessels and nerves. Sacral canal, continuation of the vertebral canal. Sacrum and coccyx. Sacral hiatus, inferior opening of sacral canal. Sacral promontory, rim on anterior and superior part of sacrum. Coccyx, attached to sacrum by ligaments.
The thoracic cage. Sternum. Manubrium, articulates with the clavicle. Xiphoid process, inferior end made of hyaline cartilage in children, but ossified in adults. Jugular notch. Sternal angle, between body and manubrium. Body.
Ribs. Tubercle, inferior. Costal groove, depression along the inferior side. True ribs. 1 to 7 are vertebrosternal ribs, attached to the sternum through their own costal cartilage. False ribs. 8 to 12. 8 to 10 are vertebrochondral ribs that attach to the sternum indirectly via the costal cartilage of rib 7. Floating ribs, because they are not attached to the sternum.
Thank you for watching. If this helped you, please like and subscribe for more anatomy lessons. See you next time.